Hi everyone, was a test design, work associated with partner ISOCARD. Our design project is to implement a decentralized mobile assistant program for Umlazi, the biggest slum community in Durban. As a team, our aim is to provide accessible options for individual processing disabilities located within informal settlement of Umlazi. We have provided a sustainable development intervention that involves the addition of accessible transport options for residents with disabilities. Our team has used an empathetic approach to not disturb the many jobs created by the local existing minibus taxi industry in Malawi. We believe this is an important issue as a notable correlation between poverty and disability exists.
Due to apartheid-based urban planning, a system that saw the segregation of people based on skin color, settlements such as Umlazi are poorly positioned in relation to opportunities and have been purposely designed to have inaccessible public transport. In the case of Umlazi, this means that it is situated 23 kilometers from the Durban CBD, which contains many employment opportunities and facilities that are absent within the local area. People possessing disabilities often require healthcare more regularly than other residents of Umlazi. South Africa offers pre-primary healthcare for these individuals. However, cost of accessibility has been noted as a major barrier preventing many from attending these much-needed services. Public transport options have been noted to be the cheapest transversal method. However, their scarcity proves to exacerbate this already present barrier against accessibility. As a result of this poor accessibility, the community started its own alternative. The minibus taxi industry, which now accounts for up to 70% of all transport within the country and provides entrepreneurship opportunities to residents of Umlazi, now exists. This industry has, however, presented vulnerabilities towards the community as it is rife with issues such as gang violence, territory wars, and unregulated business practices. It also operates on an efficiency versus profit relationship, which means that many people who require additional assistance are left behind. This includes those with disabilities. The current government solution, known as Dial-A-Ride, uses vehicles containing advanced machinery to pick up and drop off individuals with disabilities throughout eThekwini. However, due to only having a limited number of vehicles, it can cost up to 85% more than its fixed route counterparts, and does not pick up non-work related trips in peak hour.
Considering the above-mentioned factors, we have decided to design an intervention to combat this. Our proposal will incorporate the addition of a specialized disabled public transport system called Itapu. This scheme will involve a decentralized fleet of converted Toyota Quantums acquired through the taxi recapitalization program, an ongoing scheme allowing owners to sell their vehicles to the government. Instead of running as informal business like current taxis, the service will be operated by the government and create jobs within Umlazi by sourcing the accessibility conversion work to local mechanics, employing human assistants instead of using expensive machinery to keep costs down, and by employing individuals for the call center. For planning, it is important to know the formal public transport options within Umlazi that can be accessed by residents with disabilities from all subsectors. Considering there is only one main road leading to the highway that connects to the Durban CBD and plethora of transport options that only have pickup points along this road, accessibility for the outer line sector is unaccounted for, requiring them to travel to central areas and adding to already problematic congestion. Therefore, we propose that our system will not transport individuals straight to and from their destination, but instead set the drop-off points at the closest train station, the only method of transport not contributing to an increase in traffic. According to the research, only 2 formal bus stations in Umlazi district exist, and there are 5 train stations located along or near the main road, highlighting this as a more efficient method as well. It has also been noted that trains within eThekwini possesses greater accessibility options and are more affordable than private taxis. The mechanics listed within and close to Umlazi serve as an example as business that conversion of regular minibus taxis to increase accessibilities can be made.
Atapu's research by design framework draws on its contextual data combined with conceptual design methodologies of flexible infrastructure to ensure its resiliency and adaptableness. To provide an effective service equilibrium, fleet resources are efficiently distributed among each of Umlazi's 30 wards as identified by a fleet service count. This fleet service count is a general blanket disability ratio that is assessed in conjunction to each of the ward's proximity indexes pertaining to the nearest train station. Each fleet service will be assisted by a help hub, which caters to the traditional dial-in services and coordinates fleet movements. It should be noted that while this framework administers to SDG 11.2 and 11.3, it should be also mentioned that it caters to Umlazi's human needs of freedom, understanding, and participation.
In order to facilitate efficiency between all sectors involved within the ITAPU system, a centralized call system is proposed. This will involve the individual in need using either their mobile or telephone to contact the municipality, as this service will work in conjunction with the current municipal services available. Once contact has been established, they will be required to provide information regarding their current location and desired drop-off location. Using this information gathered, the municipal call center locates the closest hub to the location specified. A call is made to this hub, to which the hub manager on duty receives the required information, passing it down to the drivers operating the vehicles. All drivers will be supplied with an affordable smartphone for GPS services if they do not have access to one. Once they have been contacted regarding pickup and drop-off details, they will proceed to carry this task out, the human assistance aiding with the boarding and disembarking process.
In Stage 1, planning and preparation would need to be completed. This would involve establishing a government division to oversee the operation, establish avenue, engaging with taxi recapitalized programs serving disability type and mobility system, and research flexibility. As for Stage 2, implementation and regulation need to take place. This involves creating regulations for employees, flexible points and mechanics, conversion work to local mechanics, vehicle roadworthy tests, and coveting flexible infrastructure points in locations as number of vehicles needed to create central call center. Followed by Stage 3, which would see the operation be rolled out. This operation would begin with the more popular area. As more vehicles are acquired, more hub points need to be completed. Last but not least, Stage 4, modernization, will be undertaken by modernizing calling system, transitioning from phone-based system to app.